Lupus can be missed easily. And what's even more tragic is that severe lupus can also be missed by your doctors. Hi, I'm Dr. Micah Yu. I'm a board-certified integrative rheumatologist, and I see lupus in my clinic and in the hospital as well. And today, we're going to be going over the severe signs of lupus or even end-stage signs of lupus that you don't want to miss. I want to start off by saying that lupus is treatable and it can be managed and you can live a normal life with lupus. However, you don't want to miss lupus, and you definitely don't want to miss the severe signs of lupus, which I have seen over and over again. When I was in training during my fellowship and as attending as well, I saw patients that came in for the first time in the hospital and was diagnosed with lupus in the hospital and not at the clinic. And some of them were in the ICU. Unfortunately, some of them also passed away from severe lupus. So that's why I'm making this video, because you don't want to miss these signs. A lot of doctors are not trained to identify lupus, and it is up to your responsibility as a patient to take control of your own health and to recognize some of the signs that could be lupus so that you can ask your doctor to refer you to the right specialist, which would be a rheumatologist just like me. So in a previous video, we went over the early warning signs of lupus, but today we're going to be going over the severe signs of lupus or even end-stage signs. And we're going to be going from head to toe. And I'm going to be covering different organs that you need to know about and the lab work and the physical signs that you need to watch out for. So let's start with the kidneys. Why do I start with the kidneys? It's because you don't want to miss lupus nephritis. That's what lupus of the kidneys is called. And how do you identify this? Well, you can get lab work because sometimes there's no pain. Essentially, there isn't pain at all if you have lupus of the kidneys, but the lab work will tell otherwise. You want to look for something called proteinuria. And how do you identify this? Well, your doctor can order labs that call urine protein. And you want to get the urine protein creatinine ratio. And you want to be less than 500. If your urine protein is greater than 500, especially urine protein creatinine ratio, that's a sign that something is attacking your kidneys, making it leak protein into your urine. It's not normal to have protein in your urine. Sometimes diabetes, especially severe diabetes, can leak some protein in your urine, but lupus can also do this as well. So ideally, the amount of protein in the urine is 0. However, in lupus patients, it can be 500. I've seen it up to 10,000 as well. So definitely do not miss urine protein. And your doctor can also run something called a urine analysis, which will get a global picture of how your urine is doing and whether there is some protein in the urine. That's the first step. The second step is a urine protein creatinine ratio, like I mentioned earlier. Ideally, you get both labs together. And a physical sign that you're leaking a lot of protein in your urine is something called anasarca, or a lot of swelling on your soft tissues, because when the protein leaks out of your urine, there's less protein in your blood, so there's less fluid being retained by your blood vessels, so it's leaking out into your soft tissues, or also called as third spacing, which we call in medicine. So it's going into the soft tissues, so you feel like you're gaining weight, you seem bigger, your clothes don't fit as well, and there's more fluid in the legs and the arms and possibly the face as well. So that's a very severe sign of lupus. You don't want to miss these signs, because the end-stage sign of lupus nephritis is dialysis and scarred kidneys which don't function anymore. So if you see this, then definitely get on treatment and see a rheumatologist as soon as you can. Another severe or end-stage sign of lupus that I have seen in the hospital is neuropsychiatric lupus. Of course, you can have some brain fog, fatigue, memory issues. Those are just some early warning signs of lupus. But what do severe signs of lupus look like in the neuropsychiatric space? Well, I will tell you that I've seen patients come in with a coma. They were completely knocked out in the hospital. They were in the ICU. No one knew what was going on until we ran some lupus labs, and it showed the lupus labs were off the chart, and we finally found out that the patient had severe lupus causing a coma, which required steroids and even immunosuppressive medications. You don't want to get to that stage. Also, severe neurologic involvement of lupus can also include seizures as well. You can definitely get seizures from lupus because lupus can attack the brain. You can also get something called transverse myelitis, which can cause stroke-like symptoms where your legs sometimes can't move, or you have numbness and tingling down your legs because the lupus is attacking your spinal cord, which controls the lower half of the body. And also something called mononeuritis multiplex, which can involve the extremities such as the arms and the legs and cause severe tingling and numbness, and possibly causing you to have paralysis of that one extremity or leg or arm from lupus involvement of the nerves. So those are severe signs of lupus in the neurology space. So if you see this, definitely talk to your rheumatologist or even go to an urgent care or emergency room. Now let's talk about the heart. Did you know that lupus can attack the heart and also cause heart attacks? Just like many other autoimmune conditions, the chronic inflammation from lupus can raise the risk of heart attacks. And you can also have lupus attack the heart tissue and muscle, causing something called myocarditis. And in order to diagnose this, of course, you get lupus labs, but also you might want to get an MRI of the chest to identify lupus myocarditis. Also, lupus can cause heart failure as well. I have seen 20-year-olds, 30-year-olds in the hospital that came in with severe heart failure and even heart attacks, and they did not know that they had lupus until we ran the labs. This is very unfortunate. But luckily, these patients survived and are probably doing very well today because of the treatments that they're on. So please take care of yourself so you don't get to that part of lupus. There are two signs of severe lupus that I want to talk about involving the lungs. Number one is interstitial lung disease. What is interstitial lung disease? What interstitial lung disease is pretty much lupus attacking the lungs, causing inflammation and scarring of the lungs, also known as fibrosis. Is it treatable? Yes, you can get down the inflammation of the lungs with lupus treatment. However, you don't want to get to the scarring and fibrosis stage, because when that happens, you can't really stop and reverse the fibrosis or scarring, but you can stop the inflammation from attacking lupus of the lungs more. Also, you can get something called pulmonary hypertension, where the blood pressure in the lung vessels go up to the point where you're getting fluid in the lungs and you're having difficulty breathing. So what are the outward symptoms of these two manifestations of lupus of the lungs? Well, if you're noticing that you're having trouble breathing, you're short of breath, walking up the stairs, which isn't normal for you, or even lying down and just resting and you're short of breath, that can happen in lupus, and especially in severe signs of lupus. I've seen patients just lying flat and they can't breathe anymore. They need oxygen, they need to go to the hospital because the inflammation and fluids is building up in the lungs. So that's something I have seen quite a few times in the hospital, especially in the ICU of my patients with lupus. Now let's talk about your blood cell counts, also in the hematology space. Did you know that lupus can bring down all your blood cell counts, which include the white blood cells, the hemoglobin, and the red blood cells, and also the platelets? All of these three blood cells are crucial to your overall well-being. And you can get this lab simply through something called a CBC. A CBC will cover all of these labs. And I have seen all three come down together almost to zero before in severe lupus, which I was consulted for when going to the hospital. Or I've seen one or two of these go down. But in severe signs, you're seeing all these drop down to almost zero sometimes. And you need to get different specialists involved, including rheumatology and hematology, oncology as well, to figure out how to bring these blood cell counts up, which will include high-dose steroids and possibly medications such as rituximab in the hospital. Yes, even though I am integrative and holistic, I don't mess around when there are severe signs of lupus. I give conventional treatments because that is probably the only way out in that emergent situation. But later on, of course, you can combine integrative treatments on top of the conventional treatments. But in the hospital, we don't mess around and we want to save the patient as soon as we can. Also, you can get blood clots and strokes from lupus. You can get something called anti-phospholipid syndrome. And what that is an autoimmune disease that is related to lupus that can cause blood clots much easier. And also it can cause recurrent miscarriages. So if you have anti-phospholipid syndrome, which you will need either a blood clot, recurrent miscarriages, and anti-phospholipid antibodies positive, if you have these three or two of them, then it does require blood thinners to maintain and manage the problem. Now, you might not think skin can be a severe sign of lupus, but it can. Skin can be involved with lupus, and you can have different rashes, from lupus, including severe hair loss, scarring of the face and the body, and also you can get lupus vasculitis, where it can look like red rashes on your arms, legs, and body, and it's inflammation of the vessels. And it can be very severe, covering multiple body parts of the body. And it can be very painful as well with lupus rashes. So it can be something called subacute cutaneous lupus or cutaneous lupus. That's how your doctor, your rheumatologist, and dermatologist will diagnose it. So please be aware of rashes of lupus, because it could be an outward sign of severe inner lupus. Let's talk about the musculoskeletal signs of lupus. Yes, you can get arthritis, which isn't a severe end-stage sign of lupus. However, you can get severe signs of lupus and autoimmune disease, such as myopathy. So that is lupus causing inflammation and weakness of the muscles to the point where you can't raise your arms, you can't walk up the stairs, and also you can get severe arthritis to the point where your hands, feet, and different body parts are being disfigured, and you might need surgery to fix it if it's severely disfigured. And for patients who are on long-term steroids, you have to be aware of one thing. It's called osteonecrosis or a vascular necrosis, where it causes a joint to pretty much die off because there's loss of blood supply. And that can happen in lupus, especially in patients who are taking high-dose steroids for a very long time. So overall, we've covered a lot of different symptoms today. Not everything, but a lot of different symptoms that are common in severe or end-stage signs of lupus, which is treatable and manageable. So don't give up. So we've covered the kidneys, the nervous system, the heart, the lungs, the musculoskeletal system, the skin, and also the brain, if I didn't mention that already earlier. So if you enjoyed this video and you have lupus, you can reach out to me. I'm located at drlifestyle.org, which is my clinic where I do telemedicine and in person. I'm located in Southern California. And if you like this video, please hit the like button and subscribe button as well. It will help me get the message out to the community with patients that need this video the most. And also comment below, what did you like about this video? What did you learn? And I do have a podcast called Autoimmune Alchemy, where you can find it on Spotify and on Apple and anywhere that you can listen to a podcast, where I go deep into conversations involving chronic illnesses and autoimmunity with guests and my co-host, Dr. Mandala, who's also my wife. So you'll probably learn a thing or two from those videos as well. And if you're interested in getting more information from me and want exclusive access, then you can join my autoimmune club, which is a new platform that I've created where I give live lectures and Q&A to you all. And also my wife, Dr. Mandala, will be doing a mind-body medicine workshop once a month there as well to help you guys get through chronic illnesses and be a guide for you. So I want to thank you so much for watching this video. I really appreciate your time, and I'll see you guys next time.